So for months, we've talked about a time when we would run out of options, a time when we would run out of space to care for sick patients, when our options would be limited, when the virus is hitting us so hard that the healthcare system we have would be unable to address the people's needs. That terrible time gets closer with each passing minute, each passing hour, and each passing day. The number of people with the virus is skyrocketing in our region. The number of people so ill that they have to go to the hospital is nearly 3 times what we described as a sustainable level. The number of people with COVID in our intensive care units is higher than ever. The real peak of this pandemic has yet to come. At the pace we're on right now, we could easily double the number of COVID patients in our hospitals within about 2 weeks. At that point, we will not have the capacity we need to sufficiently care for our patients, not just COVID patients, but all patients. Unfortunately, as has been painfully obvious to even a casual observer, we are past the time when individual behavior alone can address this disaster. Healthcare systems across Missouri need Governor Parson and the state to take additional action to prevent unnecessary illnesses and deaths. When it comes to the virus, we are all one big county now. Every day, COVID patients are crossing county lines to go to hospitals. The lack of a mask mandate in one county has implications for residents and healthcare professionals in other parts of the state. The spread and cases are blanketing the state, and no locale is safe anymore. So let me be really clear on this. A statewide mask mandate is needed to save lives across the state. Secondly, we are also asking the state to work with our system's emergency managers to start planning for what will happen when the healthcare systems become overwhelmed. Our healthcare heroes have fought valiantly day after day, but we have no reserves. We have no backup that we can suddenly muster to come in and save the day. If we stay on the path that we're on, even just 2 more weeks, we will not have the staff we need to care for patients. It's now just a numbers game. We are danger close. Finally, we are asking for a statewide safer at home policy. Such a policy would limit the face-to-face interactions and decrease the spread of infections. This policy would instruct residents to stay home except for specific things such as school, going to the store, seeking medical care, among other things. This would greatly help slow the spread of the virus by eliminating social gatherings that we know continue to be the avenue for sustaining this great pandemic.